Justin Bieber's recent declaration that he had Ramsay Hunt Syndrome was both somber and frightening for both the 28-year-old singer and his fans. Watching the singer discuss the virus's impact on him in a video posted last week in which he revealed that he suffers from partial facial paralysis drew quick attention to the condition, whose severe symptoms caused Bieber to postpone his Justice World Tour to obtain treatment. The syndrome was caused by the same virus that causes chickenpox and happens when a shingles attack affects one of the facial nerves near the ear. As Bieber stated in his video, early treatment and rest are the recommended treatments. On Monday, Bieber provided an update on his condition, saying that every day has gotten better. Billboard reached out to Los Angeles specialist and otolaryngologist Dr. Amit Kochhar, a facial plastic surgeon and director of the Facial Nerve Disorders Program at Pacific Neuroscience Institute at Providence St. John's Health Center in Santa Monica, California, to better understand the syndrome's potential impact and the singer's prognosis. While Kochhar has not treated Bieber for Ramsay Hunt, he did speak to Billboard about the effects of RHS and what the singer's route to recovery would look like. In 2020, Justin spoke about being diagnosed with incurable tick-borne ailment, Lyme disease, as well as a serious case of chronic mono, which he said at the time had affected his skin, brain function, energy, and overall health. Is there any connection between those diagnoses and RHS? Mono, commonly known as Epstein-Barr syndrome, is not connected with facial paralysis. I've never seen an Epstein-Barr patient develop facial paralysis, and if it's unusual, it's extremely rare. When Lyme disease first appears, there may be some facial paralysis, sometimes known as lockjaw, as well as a rash. However, I've never seen Lyme disease reactivation cause RHS. He must have had chickenpox at some point in his life, and if he received the vaccine, he may have RHS if a breakthrough infection occurred. Most of us experience chickenpox as children, which lasts a few weeks and then goes away, but the virus remains in our bodies as part of our DNA for the rest of our lives. It hangs out in the nerves and the immune system and can be tolerated, but the immune system cannot fight it off when there is immunological suppression, acute exhaustion, or stress. I don't believe his Lyme disease history is a role, but persistent exhaustion doesn't help when other sources of stress can impair the immune system, such as a large tour that stresses his body greatly during performances. How is RHS related to shingles? Ramsay Hunt is essentially shingles on the face. Shingle is a viral infection that causes a painful rash anywhere in your body and is caused by the same varicella zoster virus as chickenpox. The reactivation of the zoster virus in the nerves of the face causes paralysis because the facial nerve passes from the brain stem behind the ear and into the face to provide energy to the facial muscles. When that nerve becomes irritated, it extends behind the ear and into the skull. It resides in bone and bone doesn't move, so the nerve swells while the bone remains static. Essentially, it's a crush injury to the nerve. You may experience pain behind your ear or severe headaches for a day or two before waking up the next day with your face paralyzed. What's the best way to treat it? It sounds like time is of the essence. You must tackle it as soon as possible. Ramsay Hunt suffers from a more severe form of Bell's palsy, a disorder that causes sudden weakness in the muscles on one side of the face. Most people recover in a week or two, but Ramsay could take up to 2 months to recover. As a result, you want patients to start taking anti-inflammatory medications as soon as feasible. I'm not sure about his other symptoms, but they can induce vertigo, dizziness, exhaustion, and agonizing pain. Given that you don't know the specifics of Justin's case, what is the prognosis for someone his age with these symptoms? Is there a treatment? Cure is not the proper word. Do you completely recover? You can't treat it since it's in your body and the virus doesn't go away. The recovery of the nerve is dependent on how quickly the face begins to move again, which is usually tied to how quickly you can start steroids to decrease inflammation and other treatments like antivirals to prevent discomfort afterward. To be clear though, it's not fatal, and he'll most likely be able to resume his previous activity, right? It's not lethal, but the longer it takes for the nerve to recover, the more probable you'll have serious nerve damage. If you don't recover from chronic facial paralysis within 2 to 3 months, your eye may close or the corner of your lips may pull up when you talk. If a patient is comfortable in their skin, they might not care to address it. However, Other people have underlying facial stiffness and pain when eating or drinking. That could be terrible for some people, especially if your looks are important to your livelihood. We offer physical therapy, pressure point massage, and other things to help folks retrain their face to govern the muscles if they wish to improve such concerns. He may be able to recover completely if he recovers fast and without complications. If it lasts longer than 1 to 2 months, you may have nerve problems, mainly involving your eyes. Most significantly, because it affects nerves in his face and ear, is it possible that Justin's voice will be affected? I'd be astonished if he had any vocal troubles, even in extremely uncommon situations with other cranial nerves, such as the nerve involving in swallowing and speaking. Failure to fully recover is extremely rare. Anti-vaxxers are certain that Justin's facial paralysis and Ramsay Hunt are linked to the COVID-19 vaccine. According to what I've seen, there is no reliable evidence demonstrating any probable link. Is this also your understanding? It has nothing to do with the COVID vaccine. That, in my opinion, is irresponsible because there is no genuine research to support the claim that COVID vaccinations cause Bell's palsy either. 1 in 10,000 persons will acquire Bell's palsy, and people who have received the COVID vaccine are at the same risk as those who would have developed Bell's palsy. So, persons who received the vaccine are not more prone to develop Bell's palsy. It's the same number that would have received it anyhow. There are also many people with Bell's palsy and facial paralysis who have had no recurrences since receiving the vaccine. Do I believe they're related? It's quite unlikely. Justin Bieber's wife, model Hailey Bieber, told Tonight Show host Jimmy Fallon on Wednesday night, June 16th, that the singer is doing okay, remarking that it's been a strange turn of events over the past few months, referring to her mini stroke and Bieber's recent diagnosis. He's fine. And he'll be fine, she assured Fallon. We all hope for the best for Justin Bieber and that he recovers quickly. Thanks for sticking to the end of this video. Make sure you subscribe to this channel, smash the like icon, and hit the notification bell. Thank you.